My name is Dr. Ram Ramtal. I'm a GP at Highcliffe Medical Centre partner. I also work for Dorset CCG and I'm the locality chair and a governing body member. 2007, Dr. Richard Jenkinson and Dr. Stephen Collins, they wanted to integrate the community nursing team to put the patient at the centre of care and make things much more efficient. And then with regards, this has been moving and been talking about it for several years. And then with the help of our friends from NAPC, we've now started to do an integrated community nursing team, putting the patient at the centre, improving care, reducing the administrative work of our Dorset Care nursing team, and much more efficient. Normally what happens is, let's say a patient's been discharged from Bournemouth Hospital who's needing to be started on insulin. A community nurse will be the first to go and see them, and then they'll come back and speak to one of our specialist diabetic nurses, and then they'll have to go back out and see them again, and then they may need some blood tests and another person may need to go out. What's happening now is as soon as that referral comes in, the pathway will change. They will speak directly to a GP, directly to the specialist diabetic nurse, who will go out and initiate insulin if needed, do the blood test, so they've got one person instead of potentially three, and it's just a one-off appointment, and then the follow-up is then organised amongst the different nurses together, working collaboratively. We're very keen on a single point of contact, and where we've built our practice as well as at Christchurch Medical Practice is the district nurses, the community nurses are a part of the clinical hub. They also come to our multidisciplinary team meeting, which is held every Tuesday and Thursday, and if there's any concerns about a patient, they'll feed back in that forum, and you'll have all the GPs, all the different nurses there, and we can talk about patients and enter it in the patient's own records. Let's say we've got a vulnerable area here, we've got an elderly lady who's got dementia. If a neighbour talks about a patient and says, I'm worried about that dementia, the community nurse may have heard about this, they'll come back, send a message to the medical secretaries to say, can this patient be discussed at next MDT? They'll come to the next MDT, we'll all sit down with all the GPs together and we'll talk about, document it in the notes, MDT team discussion, and then come up with a plan. And we'll send a note to our administrator saying needs an urgent visit with Dr. Rav, or needs an urgent blood test, or a phone call with the family. And then therefore it's cascaded out to all the right team. If there's significant concern, then they will talk to the urgent duty doctor that day, so a visit is arranged by a medical practitioner. And there's also the virtual ward which happens, which is where we get Dorset Healthcare, Bournemouth Hospital, physios, OTs and community mental health coming together to talk about particular patients. There's all 5 GP practices in the locality, which is the Grove Surgery, Stour Surgery, Farmhouse Surgery, Christchurch Medical Practice, Highcliffe Medical Centre, and then we've been working with Dorset Healthcare along with this project. For the patient's point of view, they're being seen by the right person at the right time, so they're getting the right nurse to see them. Previously, you could have 4 or 5 different community nurses, different providers, all seeing the same patient, then referring on to a different specialist. Now what they're getting is just one person fitting around the patient who is the right person, so it's much better for the patient.